Hospice family. In this video, we are going to talk about what hospice means. We're going to talk about the word hospice. What does it mean? Do you often hear people say hospice, hospice, and you don't know what that means? If you are somebody out there watching this video, if you are a caregiver, if you are a nursing student, if you are a CNA, or if you're just curious and you're not sure what hospice means, what does that word mean anyways, huh? When you hear when you hear your doctor says hospice, or the nurse, or the social worker, what does it mean? Or your friend, say you have a friend and then the friend says, my husband is on hospice, my mom is on hospice, my dad is on hospice. What does it mean? You wanna know? Stay tuned. Watch the video. Welcome back, my hospice family. Welcome back. Good morning, good afternoon. My name is Dawn, your RN Hospice Extraordinary, all right? And I just want to say good morning to my new followers, my new subscribers. Thank you so much for coming here and being here with me. Thank you to my caregivers, all right? Thank you so very much. Now, today I want to talk, for the next few weeks, I'm going to be talking about hospice. What does it mean? Okay, what does hospice mean? What does the word hospice mean? All right. Now, this video right here is going to talk about 6 months or less, because you've heard me say 6 months or less before. And as I mentioned before, my channel is for the caregivers. As a hospice nurse for over 10 years, I've been doing this since 2012. I want to dedicate, I always said, I wanted to dedicate a channel. I want to share some information with the caregivers, because in reality, us nurses, we deal with the caregivers a whole lot more than we deal with the patients. And the reason mostly is because you wonderful caregivers, you are with the patient. You are with the patient 24/7. Us hospice staffs, we come in and out of your home, but yet you are the one at the end of the day who stays with your loved ones, all day. You see? And so therefore, it is very, very crucial for me to make sure that I empower you guys. I empower you so that you can make the right decisions, so that you can care for your loved ones to the best of your knowledge. Get it? Now, if you're a caregiver here, please let me know. Let me know your name. Let me know where you're from. Just share your story. Okay, I would love to hear your stories. Okay, I would love to read about your stories. Now, that being said, let me talk about what it means by 6 months or less. I'm going to list 5 things. I'm going to be talking about 5 things that hospice means. Okay, number one, hospice means that the doctor says that your loved one has 6 months or less to live. Okay, based on the disease, if the disease progresses, if the disease continues to follow its normal course, very, very important here. If the disease continues to follow its normal course, your loved one will die in 6 months or less. That's the first key that I want you guys to know, that I want you, my hospice family, to know. So basically what that means, what that should mean to you, like what does it mean to me? Like, why should I care? What that means to you is that the doctor says that there is no cure for the disease. It could be either cancer, it could be liver disease, kidney disease, dementia. It could be, whatever, you name it. It could be, COPD, heart disease is another big one. Okay. Just fill in the blank. The disease, if it continues the way it is going, the way it's progressing, you have 6 months or less to live. Your loved one will have 6 months or less to live, because there is no cure for it. The doctors have exhausted all aggressive treatment, all treatments. meaning that medication is not slowing the disease down. Radiation is not slowing it down. Chemotherapy is not slowing it down. Nothing is slowing down the disease. If it continues in the path that it's continuing, okay, your loved ones will die in 6 months or less. That is key number 1. Okay, like I said, I have 5 keys. I have 5 keys of knowing, okay, when you hear the word hospice, so that you can know what that word means. Okay, so that's number 1. All right, now let's go to number 2. Number 2, my hospice family. Number 2 is that hospice means we focus on comfort rather than finding a cure, rather than curative measures. We focus on comfort rather than curative measures. What does that mean to you? That means we as a hospice nurses, okay, as a hospice doctor, our primary goal is going to be to manage your symptoms, to make sure that you are comfortable. We don't do aggressive treatments. For example, okay, I've had some patients saying that we want to go to the hospital. We want to go get IV fluids. Now, we may on very few occasions give IV fluids, but we're going to ask, what is the reason for the IV fluids? You see? If you want to go to the hospital, you have to come and get aggressive treatments. That's perfectly fine. But you would have to come off of hospice. You see? And so, because at this point, going back to number 1, related to number 1, my hospice family, because the doctor says that we've already exhausted everything that we can, we've already done all that we can, because the doctor says that, therefore, us hospice nurses, we are coming in to follow orders. We are following doctor's orders, meaning that we already say that based on what the doctor says, there's no cure for the disease, unfortunately. Unfortunately, there's no cure for the disease. The doctor has already done all that they can do. So right now, it's to focus on comfort. It's to focus on your quality of life versus quantity. You see? It's for us to make sure that the last few months or days of your life is very comfortable. It's pain-free. It's comfortable. It's very comforting, very compassionate. We're not here to stick you with needles, because we've had some patients who are diabetic where we ask the doctors, okay, the doctors stop their insulin. They're no longer, going to be taking insulin. Why? Well, because they're not really able to eat. They don't really eat like they used to eat. And so therefore they don't really need insulin. So there's going to be basically no more needles, no more chemotherapy, no more radiation. It's just comfort measures. All right, so that's number 2. Let me know, my hospice family. Let me know if you have any questions regarding number 1 or number 2. And please, like I said, share your story. I would love, love, love to hear from you. Okay, as I talk about what does hospice mean? What does this word hospice that's so scary? What does it mean? And please share with your friends, share with your family this video. And of course, if you find any value to anything that I'm saying, please subscribe, follow me. All right, now let's move on to number 3. Let's see what the third thing is. The third key that I want you guys to know, the third point that I'm trying to say is that hospice, regarding what does hospice mean? Hospice means that, and that relates also to number 2. If you haven't seen number 2, review the channel, review the video, look at number 2. The third key is that we will manage your symptoms, such as, okay, these are the kind of symptoms that we will do. We deal with pain, meaning that we will be providing you with medications that's going to make you feel a whole lot better. Medications such as morphine. I've made a few videos about morphine. And if you would like me to make more videos about morphine, please let me know, okay? Such medications will be morphine, any kind of pain medications, okay? So we will manage your pain. Another symptom we'll manage is if you're having difficulty breathing, and this is especially true for those of my patients who falls under the cardiac, okay? If you have heart conditions, if you have COPD breathing, and emphysema, COPD, lung disease, lung cancer, okay? We will manage your breathing. We will give you oxygen. And all of these things are for free. We will not ask you for a dime. We'll give you oxygen. We'll give you medications to help you with breathing. We'll give you nebulizer, okay? Neb treatments, the neb machine will just, definitely help with your comfort, with your breathing. And if there's any nurses out there, okay, any hospice nurses who's out there, please add. If you have any comments, if you're going to add, let me know. Just add a comment. The other symptom that we're going to manage will be anxiety. Yes, anxiety. Anxiety is a big one. Okay, especially for our patients, for every patient actually, for every patient, but it's especially true for our little ladies with Alzheimer's, okay? We will manage your anxieties. We have medications. We usually use lorazepam, okay, also known as Ativan. We'll use Ativan, we'll use Haldol. We have things like, trazodone. We have tramadol also. So we will manage your anxiety to help you. Because oftentimes, my hospice family, when we are in pain, it causes us to be anxious. When we have difficulty breathing, it also causes us to be anxious. So you see how it kind of goes hand in hand? Another symptom that we will manage will be constipation. Yes, that's huge with our hospice patients. And that's because, from my experience, two things mostly. One is because if, for example, they are taking an opioid, such as morphine, a big side effect of morphine is constipation. So therefore, we have to be ahead. We have to be on top of the game. We have to manage their constipation. Okay, we have medications that we can definitely help with that. And also regarding constipation, it's because our hospice patients, they're most likely immobile, meaning that they stay in bed for most of the time, at least 18 hours a day. They'll be in bed. They're not moving, okay? So therefore, when we're not moving around, we are more likely to be constipated because if you know this, I'm not sure if you are aware of this, my hospice family, but when we are moving around, okay, like for example, if you like to walk or jog or run, most likely you will be able to go, daily. You'll be able to have a bowel movement daily. But if we stay still, it's going to be harder to have a bowel movement if we stay still. You see? And so my hospice family, that's another symptom that we will manage. Okay. Things like vomiting, nausea, we also manage that too. Okay. So let me know, my hospice caregivers out there or my hospice nurses, let me know of any other symptoms. Okay. That hospice has come into your home and helped to manage. But those are the main ones that I could think of right now, okay? So that's number 3. That's the third key, all right? And now let's move into number 4. Number 4 is a big one, okay? It's a big one. What does hospice mean? Why should I care? Number 4, I really like number 4. Number 4 is that hospice is a team approach. We follow a team approach, and I feel like I should make a video completely just on that itself. When I say team approach, I mean it's not just the hospice nurse. No. We have The hospice doctor, as I mentioned in the beginning, okay, we usually call him or her our medical director, okay? But not only that, but we have the social worker who's part of the team. Okay, the social worker plays a really nice big role. He or she will help you to know more resources that are in the community, like with psychosocial support. Okay, the social worker is excellent. We also have chaplain care for spiritual care. Okay, excellent, excellent. We have CNAs. Oh my goodness, our families love their CNAs. The CNAs are awesome. Awesome. They will come into your home, help to take care of your loved ones for at least an hour. They will bathe the person. The other day, I had a patient that says, "Oh, so and so is so wonderful. So and so came. Let's call the aide Marie. She told me Marie came to my house. Marie came to see me, and she gave me the best bath I've ever had because that patient just came from the hospital." And that patient spent, I believe, 3 weeks in the hospital. Just with little, they were just kind of like, using a cloth to just wash her face and, wash her, armpits and things like that. But our hospice aide, Marie, was able to take her to the bathroom, okay? We have this chair that, that sat in the tub. And then she got her in the toilet, in the shower. And Marie was able to really give her a good scrub, wash her hair. She had not washed her hair in 3 weeks. Can you imagine? And so she told me, "Oh, Dawn, Marie is awesome. My aide. Oh, I feel so good." I said, "Yes, Mrs. Smith. Oh, not only do you look good, you smell great." And she was so happy. You see? So our hospice aides are wonderful. We also have volunteers. Yes, we do. We have volunteers. And most of our volunteers are usually loved ones of previous patients who were under hospice but who now passed away. You see? So who else do we have? Some of the hospices, okay? Some of the bigger hospices, they will have a music therapy. They have pet therapy. All right, they have massage therapy. So it's not just the nurse when you think of hospice. Okay, what should this mean to me? It's a whole team approach. Because if your mom or dad used to be a music teacher or used to be into the arts, having the music therapy, okay, a music therapist will come in. I've seen, like, in one of the hospice places that I worked for, the music therapist had like a I all right, and he would go and play the guitar and sing to them. And I once had this lady, okay, I will never forget this lady, this little dementia cute little lady. She did not say, she was not able to talk, okay. She was nonverbal. She would just kind of stare at you, stare like into space blankly, just give this flat effect. But I'm telling you, the guitar, the music therapist had a joint visit with me, all right? And the music therapist took out his guitar and started to play the guitar. Oh my goodness. That little lady who is nonverbal, who never talks to anybody, who never make any eye contact. Oh, when I tell you, she became alive. She started singing and clapping her hands. I couldn't believe my eyes. I could not believe. I said, "What?" I said, "Mrs. Smith, you had all that in you?" She was, oh my God, that was such a special moment. Such a special moment. We loved it. And so you see, the hospice team, it takes on, and it's a whole team approach. So that's another thing that hospice means. It's not just one person. It's a whole team that's going to come into your home, into your life, and help take care of your loved ones, whether it's your mom, your dad, your husband, your wife. All right? Let me know if you have any questions. Let me know if you have any stories that you'd like to share, because I would love to hear it. All right, now let's go to number 5. the last and final key of what hospice means. What does it mean to you particularly, and why should you care? All right, let's go to number 5. Last but not least, my hospice family, number 5 is that everything that we do, every medication we prescribe to you, every treatment we do, it requires a doctor's approval. It requires our medical doctor to be aware, to be informed, everything that we do. I feel like that should have been probably number 2, okay? But just that I want you guys to know that and the reason why I put that down, and it's good to know, is because like hospice, we are not going to come in and take over. No, we don't come in to take over. Absolutely not. And so, meaning that we're not just making things up, or we're not just, doing things because we feel like doing it. The nurses, all right, the nurses work closely with the medical doctor. The medical doctor, which could be your own physician, by the way, that is key. Your own physician, like say for example, you have a oncologist. Your oncologist could be the one that follows you still when you are under hospice care. And so we would have to call your doctor's office, ask them for permission to do any treatments, okay, to change your medications, to modify your medications, to add a medication to take, So, and I want you to know this, my hospice family, because that is a big reassurance. Okay, that should make you feel more secure knowing that, okay, whatever that the hospice nurse chooses to do, that the doctor, your doctor will be part of it. Okay, that your doctor, is also well informed of what's going on. All right. And so that's the 5 keys that I wanted to share with you, my hospice family. Let me know your thoughts. I want to hear your stories. I want to hear your stories. Okay, so bad. All right. So as always, be good to yourself. And I love you with the love of Jesus Christ. And I pray that you found value in this video. All right. Like, share, subscribe. See you in the next video. Now, stay tuned now. I have a very special offer for you. Stay tuned. My hospice family, I would like to offer you this free guide. This free guide regarding hospice. What does hospice mean? This is going to help you to have a better understanding of the word hospice. Okay, you could share it with anybody who's having some challenges regarding trying to explain what hospice is, or trying to make a decision whether or not hospice is the right thing for them. This free guide is available in the link below in the description bar. Just click on it, okay, and enter your name and your email, and I will send that to you so you could have it. You could print it out. You could share it with anybody. All right, this will definitely help you to get a better understanding regarding hospice care. All right, sign up, get this free guide. See you in the next video.